Welcome to the day in a life of a pharmacy appy student on her appy rotations. For my first 6 weeks, I have internal medicine, also known as IM. So I'm starting off the day by waking up around 5 to 6 in the morning, depending on when I go to sleep the night before. After brushing my teeth, I start studying or doing any other schoolwork that I need to do. Today, I'm working on some modules in my NAPLEX course book. Around 7:15ish, I begin to make myself breakfast. I typically do something quick and easy like tater tots and scrambled eggs, and then after eating breakfast, I pack my lunch. So today, I'm planning to buy lunch from the cafeteria, so I'm really only just packing a little bit of extra sides. So I'm washing and cutting up some strawberries as well as packing some chips. Then it's time to change into my scrubs, fill up my water bottle, and pack the ice cubes with my lunch. So I leave my apartment around 8 in the morning since I start work at 9, and it takes about 30 minutes to get there. I like to get there early in case traffic is really bad one day, so I typically end up sitting in the car for about 15 or so minutes until it's 8:45. Then at that point, I get out of the car and I walk into the pharmacy. And since I can't film while working, I created a little simulation of what my day is like from my apartment. So just envision that this is in a pharmacy. My IM rotation is different than others in that I don't go on rounds. My day mainly consists of working at a desk next to the pharmacist. So first I do my clinicals, and these sheets are for medications such as vancomycin, aminoglycosides, heparin, and warfarin that need extensive lab monitoring. I write down all the relevant cultures and lab values for each patient and then present them to the pharmacist and make recommendations to their regimens. Afterwards, I check for any EPOGEN patients and I look at their hemoglobin level to determine if I should print their labels or not, so if we should dispense the medication or not for that day. Next, I do drug utilization reviews, so I evaluate the medications patients are on and I make sure that everything is appropriate. After I complete this, I present all the patients and any recommendations to the pharmacist. At this point, it's around lunchtime, somewhere between 1 to 2 p.m., and I take my 30-minute lunch. So today for lunch, actually, a patient's family brought in food for all the staff, so I actually ate that instead of buying from the cafeteria. But after lunch, I go back to the pharmacy and I start working on antibiotic reports. Similar to the clinical monitoring in the morning, I write down any antibiotics the patient's on, their diagnosis, relevant lab values, and any cultures or x-rays that they've gotten. I present these findings to the pharmacist, who will later call the doctor to present these patients and come up with a therapeutic plan. I then start working on positive culture reports, which is very similar. I assess any positive cultures that resulted in the past 24 hours and make sure that patients are adequately covered for the organisms that are found. Meanwhile, throughout the day, I also make phone calls as needed and answer calls that come in. Sometimes I need to ask about signs and symptoms of bleeding when on anticoagulants or get a patient's home medication regimen from their outpatient pharmacy. When it's busy in the pharmacy, though, what I explained is all I'm able to do when I go home. But if there's extra time, I sometimes am able to fill crash or surgery carts and then do medication pass reviews. Around 5:30 or sometimes later, even if it's really busy, I get off of work and I drive home, which takes about 45 minutes due to traffic, and heat up some dinner. So today I'm having some Korean food that my aunt actually made for me. And then I just study, eat dessert, do any other work that I need to do before going to bed. Sometimes I have presentations to work on, questions to follow up with my preceptor, or any module assignments to complete. But that's pretty much it. I just go to bed and then repeat it all again the next morning. So thank you for watching.